We start with the latest on the coronavirus situation in South Korea. Despite a dip in the number of confirmed cases, local health authorities are on alert over a potential uptick in new infections as we move further into the week. For more, we are joined in the studio by our Shin Ye-eun. Good afternoon, Ye-eun.
Good afternoon.
Now, let's start with the daily figures today. Although we've seen quite a drop in new infections, authorities have warned that this number could easily go up through the weekend.
Right, so on Tuesday, the total caseload stood at 1,347, and though this was a big drop compared to last week when the caseload hovered around 2,000, authorities remain on high alert, saying the lower numbers are due to fewer tests done over the weekend. They added they'll prepare for an uptick in COVID-19 cases this week because many would have traveled across the country over the long weekend.
Now, Yoon, let's talk about vaccinations. South Korea will be administering booster shots from today. Can you tell us again who are eligible?
Right, so medical workers will be the first in line to get these booster shots. And to give you more details, some 45,000 medical staff who have worked on the front lines fighting COVID-19 are eligible. Most of them have actually received their second dose of the Pfizer vaccine back in March or April. So their booster shot will be a Pfizer shot, which they can get at the medical facility they work for. Next up will be seniors aged 75 and older, or those who work at relevant facilities like nursing homes. And this aligns with the WHO's recent recommendation that people with weakened immune systems should actually be given a booster shot.
Again, aside from the vaccines, another major development is the introduction of an oral medication of COVID-19. U.S. pharmaceutical firm Merck requested for emergency use authorization from the FDA. Can you tell us more on that?
Right, we've now entered a phase in the pandemic where we have to think about living with COVID-19, and that's why drug makers around the world are trying to develop COVID-19 pills, and leading the race is U.S. drug maker Merck that has developed an antiviral pill called Molnupiravir. On Monday, Merck asked U.S. regulators to authorize its pill for treating patients with mild to moderate COVID-19 infections.
So if this pill gets approved, it would become the first oral treatment in the market. Can you tell us about the pros and cons of this?
Right, it's really good to mention the pros and cons. The biggest pro is that now you can treat COVID-19 much more conveniently at home. All you need to do is take the pill. Another pro is that the pill reportedly lowers the rate of hospitalizations and deaths by 50%. This means no more expensive visits to the hospital just because you have the early symptoms of COVID-19. And it's also been proven to be effective against the highly contagious Delta variant. But we also do have to think about the cons, which is it actually includes the cost, which is around $700 per person for the full treatment. Although, according to an insider at Merck, the final price could still change. Also, you have to take 4 capsules 2 times a day over the course of 5 days. So if you do the math over the course of the treatment, you'd be taking a total of 40 pills. Also, health experts say that while it could be a game changer, it's definitely not a complete substitute for COVID-19 vaccines. So let's take a listen to what a health expert from Texas has to say on Merck's latest treatment.
And so there's a lot of attractive features about it, just like there is for Tamiflu for influenza, which is another way to think about this. It does reduce the severity of illness, but doesn't prevent it entirely. And whether or not you wind up taking this medicine for whatever reason, you should still get vaccinated because that's the best way to prevent you from getting sick.
Right, so it can't prevent you from completely catching the virus. And not to mention, Merck has just applied for emergency use authorization in the United States. They actually pledged to produce enough pills for 10 million people by the end of this year, of which a supply for 1.7 million would first be given out in the States. While countries like South Korea have said they have negotiated with Merck to actually secure some of their pills, we're still left to see when this will happen.
So as of now, we still have to wait for the green light from the FDA.
Definitely.
Thank you so much, Ye-eun, for your efforts. We will see you again tomorrow.
Thank you.